welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. So good to see you. And if you're new here, let me just tell you a little bit about what we're focused on doing. So we are a healthcare innovation company, and we're focused on bringing real stories from real people that are in our space to the forefront, showcasing how people are making a difference. We're really passionate around access to care, around innovation adoption, and leadership. So as part of our commitment to just kind of keeping you updated with the latest and greatest, I want to introduce our next guest. She's really a fabulous person. I'm incredibly excited to introduce her. Catrina Rodriguez. She is the Director of Behavioral Health and Social Services at the Health Plan of San Joaquin. And she's not just at the forefront of the industry. She's really making waves through her hands-on approach to making stuff happen at the grassroots level. And her drive to excel within our space isn't it's not just professional, it's personal. And her journey at this point is not only just impressive, quite frankly, it's empowering. And she's entrenched in these crucial day-to-day operations at the health plan, where real change that's created is really coming from the ground up. And just inspired by her own stories and a deep-seated passion for helping others, Catrina, she leverages her expertise to really push the boundaries within behavioral health and fostering a really bright future for countless individuals. So stay tuned as we kind of dive into these really interesting areas with Catrina about her vision, her contributions, and sort of the powerful experiences that are steering her mission within our space. So Catrina, it's great to have you on the show. Welcome.
Great. I'm really glad to be here. Thank you so much for having me.
Of course, it's my pleasure. Maybe we dive into a little bit of your story, because I think that is something that is really unique about what you're doing. So talk a little bit about your journey and where you are today, and kind of things that spurred on your appetite, your drive, your desire for doing what you're doing today.
Yeah, definitely. And thank you for that introduction.
Of course.
For me, I grew up in a home where it was definitely evident that access to mental health was needed. And in our community, there were a lot of limitations and a lot of stigma. And as I became an adult, getting into the managed behavioral health space, I started to explore even more so what that looks like at a macro level. At the same time, I decided to go for a couple of degrees. I ended up with my master's in social work. And through that work, I learned a lot more, and I became a parent. And I wanted to make sure that my children didn't have a lot of challenges that I grew up with. And so I really focused on, creating an environment for that and noticing what the exterior environment looked like as well. With that, both of my children have, helped shape me into becoming the person I am and helping me with my direction. I have a younger one, which has a lot of special needs, a lot of medical diagnoses, as well as, needing support. So making sure that that was accessible for her, navigating all of that. I ended up becoming a parent and caregiver advocate, knowing that it can be so difficult just to feel like you have the strength to have the conversation that is needed to have, whether it is with your school district or, with your healthcare providers, or even just knowing what's available. I learned that there were not a lot of forthcoming of what is available, and just being there for folks, giving that psychoeducation and making sure that they feel empowered, they feel supported. I had a partner with that. One of the school districts or one of the schools that my daughter had gone to, she helped me along that way, so I wanted to pass that along. And then, with my journey in the insurance space, I began in a time where it was shortly thereafter that the Federal Mental Health and Equity and Addictions Act came into place. And I was a part of implementing that for the health plan. And with that, there was a big strive to create more equitable access where you had similar services available. There weren't as many limitations, let's just say, on visits. And the cost of share of cost was not actually different for accessing mental health. I don't know if you're
Right.
aware. Before that, people were spending a lot more, almost double the amount of what they would if they were to go to a primary care visit. So it was very interesting, and it led me down a path of still focusing on behavioral health and wanting to make sure that there continues to be access. And what I've noticed over the regulators is that they haven't, historically, they had not shifted in any of those areas of access. There's a standard, amount of providers within a certain area or within a certain time that we have. However, in the last year, there's been a major shift from our regulators, and it's been focusing around behavioral health. Even more so, they've been focusing on different ways, innovative ways of, looking for accountability when it comes to access. And it wasn't that long ago that I had a conversation with my daughter, my oldest daughter, around what peers her age, so she's 15, what that looks like.
Well, hold on a second. When you mentioned accountability, what does that look like? What did that look like before, and what does that look like today?
Yes. So before, each health plan submits their network to their regulator and completes regulatory reporting around access, which demonstrates typically a ratio, so amount of providers to the amount of members that they're responsible to cover. And it's usually broken down by specialty. And then there's also time and distance. So of the members that you're responsible for, you have to have access within that time and that distance, depending on that geographic area.
So let me ask you this. So how many members today, approximately, you don't have to give definitive numbers, but like how many members do you have oversight over? And then what do those, if this was a pie chart, what percentage of those folks do you need to quote unquote have access for? Like what's the minimum threshold? I mean, trying to see where's the floor today?
Question. And our health plan is responsible for over 400,000 lives in the state of California. And those are direct lives. However, our regulator also makes sure that we have what's points of license time, where you actually are responsible for almost the community. So they take the population of the communities and see how many providers you have to serve the community. Because those are potential members that we could end up with.
Right.
And so it's beyond what we actually are assigned, if you will.
Okay.
Threshold to meet that for our communities, each community has a different threshold because we have our urban areas and we also have some rural areas. So the distance time gets expanded when you're in a rural area. And so we have to meet between 90 to 100% of that membership within those time frames that they have and those distance that they have.
Does that include telemedicine or virtual type of care? I guess where does that kind of come into play? If someone's in a really rural area, not able to drive, I guess how much of what virtual care potentially has the ability to do impacts that?
So the telehealth options expanded significantly around the pandemic, and that everything in person had shut down. And so the regulators had adjusted what was available to allow providers to offer telehealth more expansively. And that has just recently shifted within the state of California for what those regulations are. And so it does empower a lot of rural areas to also get specialists available so that their communities don't have to travel to access those specialists. However, you still have to have like an originating site. In most cases, you have to have good internet access to have that conversation. And those can be still challenging in a rural area. For myself, my daughter I live in a rural area. I don't live actually where my health plan is. So for us to access specialists, we actually fly to access her specialist because she needs neurology. And so we rely on flights to get us to those specialists. Thankfully, we do have a resource that allows us to access it through volunteer pilots. So I really appreciate that. But just in and of
Well,
itself,
that's amazing. I didn't even know that existed. Can you share more about that? Do you mind?
I don't mind. It's called Angel Flight West. It's my understanding that they have a couple of areas that they serve, and they have been, for lack of a better word, a godsend to us.
Yes.
I have been able to take my daughter to her neurology, to her ENT, which is ear, nose, throat doctors, to all of that specialists that we don't have in our community, free of charge by pilots who volunteered their time,
Wow.
volunteered their airplanes. Um, they have been absolutely amazing. There was a time where the weather was really bad and the volunteer pilot couldn't come pick us up. So Angel Flight purchased a commercial flight for us to get access to our appointments. It was absolutely amazing.
Wow.
No,
If you don't mind, we'll make sure we put the link in the description. I guess, free airtime for them, pun intended. But that's
they
really cool. Is that only for California or is that, nationwide?
I believe that they have gone into other states.
Okay.
Our region is called Angel Flight West or West Region, I
Okay.
imagine. I'm aware that they do fly out to other states, but they've taken California residents to other states as
Okay.
needed specialists. And it's actually more than just flight. They have offered for hotel accommodations if we needed it, but I have family in the area, so thankfully we're
Okay.
able to reside there. But they also offer ground transportation to and from the airport that we need access to. So, and this last holiday, you don't have to put this in the interview, but
Mm.
this last holiday season, they actually chose our family to also give us gifts. And
Wow.
it was so amazing. They had pilots come, they had like this like little party or whatever before packaging everything for us. And they brought us much stuff, but it was just so sweet. They're just so heartfelt, and
Yeah.
they were that hadn't actually taken us before, and they're like, "Oh, we hope we see you on the volunteer list. We'll sign up for you." It's just so nice.
Wow. Wow.
They're amazing people.
Well, just, as you mentioned that, first off, thank you for just being so authentic and just sharing your story. And, as a parent that also has kiddos that have unique needs, uh, I will leave no stone unturned to do something for them. And then to sort of see to the lengths that you're going to, for your kiddo is not only inspirational and motivating. I'm wondering how do you take that similar approach and apply that level of compassion to a much, much, much broader community? If you're doing it for the N of one right now, your kiddo, is it difficult to take that same energy, that same type of drive and apply it to a just casting a wider net? Like, can you maybe talk me through that thinking, or is it translatable?
Thank you. I appreciate that inquiry, and it is very translatable. So I prefer to work at, we'll just call it a macro level, where I can impact more lives as much as possible, which is
Mm,
why I'm on the administrative side, because I can see where the opportunity for change is there, and I like to be a part of that. And knowing that as an insurance, especially our insurance is Medi-Cal, so Medicaid,
mhm.
those our members can come and go. Literally every month they can come and go. And I work with our teams to know that, to keep that in mind and work and understand what's available in the community, what kind of additional supports should they be aware of, should we get them leased to? Because they're not going to be our member forever.
Right.
And we want to make sure that they're the most successful that they can be. So and that's why we're in behavioral health and social services. So we span a lot of needs. And it could be your basic needs to your high psychological needs or other needs of that nature. So identifying that and wrapping everything that we can around them to help them meet those basic needs so they can start working on those more complex needs.
Yeah. Amazing. So what are some initial things that you're really digging into now? Can you maybe talk a little bit about maybe some of the areas of focus and how you look at things from a 30,000-foot level and yet can kind of swoop in to make change happen? Because you mentioned some of the regulatory changes that kind of shifted the winds. Can you maybe share some examples of what that looks like tactically when you're trying to make change happen?
Definitely. And I see it as a couple of different ways because
Okay.
for myself, just at a basic level, when I was in my master's program, we learned a lot about policy, but we didn't really learn what to do with them after they became legislative active. We were like,
Yeah.
well, what do you do? How do you apply all of these great ideas? And when I work in the managed care space, I have the opportunity to apply those. And so I actually, part of my bringing it to the masses is going back to the master's program that I had gone through and educating those future social workers.
Mm,
This is what it looks like applied. This is how you become an effective social worker with all those changes that are happening. This is how you influence change. And this is how you work through that change and identify how to make it available to the people that you're serving. Because some of them will become direct service providers, some will
right.
not become direct service providers.
Hmm.
And it's just so interesting to see that like click. They're like, oh,
Mm,
this is what they're talking about. And so, and then in as a managed care plan, that's what we call us. We work with, we have to work with our community providers at the minimum, right? And so we can work with the regulators of disseminating the information, just passing it through. But unless if you have
right.
actual partners who are going to work with you on making sure that whatever that initiative is actually
Yeah.
available and communicated, and we can make referrals and they can have access,
Mm.
from nowhere, and it's going to be flat. So I believe that our health plan has really strong community partners, and most of that space.
What makes a good partner?
Good partner, I would say part of it is that accountability. Our partners do share in the accountability space, and they have definitely drive to support the community. So they have a lot of heart and teeth in the game, and they want to see that their community is thriving the way that it needs to thrive. And so we partner with them, and that looks like them giving us feedback of things that we might need to do differently, whether it's how we communicate with them as a provider or how we're sending referrals, how we help educate them and their providers. Like, let's say they get new staff on board, and how
Right.
does that look so that they can learn how to work with us? Or it also can look like collaborative meetings where we are coming up with bright ideas and say, that sounds great. How do we do that?
How often
So,
do you meet? How often do you meet with these types of partners? Like, what does that look like from a cadence of accountability standpoint?
so at minimum, we definitely meet quarterly because there's a lot of the regulation of,
Yeah.
reports and data and those kinds of things. But meetings of the mind happen a lot more frequently and happen at different layers of our organization and in their organizations as well. So it is a continued conversation
Okay.
and continued mind thinking, in that every time our community is experiencing something new, they'll bring it to us and be like, hey, this is what's going on. Do you have some ideas of how we might be able to support XYZ? And then we go from there. So It's definitely not a once a year kind of a thing. It's a lot more frequent.
Listen, it's very encouraging to hear that this is a regular thing because more often than not, you hear horror stories of providers and payers, not communicating regularly. And if they do communicate, it's more of like, hey, this is what's going to happen. And here's a mailer that tells you this. And, there's no relationship. It sounds as though that the bridges that you're building are real relationships. There are layers and layers of connectivity. And when you kind of come alongside of someone and instead of sitting on opposite sides of the table, it sounds like what you're doing is like you're sitting on the same side of the table and you're saying, hey, what's the issue that we're trying to battle here? And what are we trying to do about it? And my question is the stuff that you're trying to measure, do you try to find alignment on what to measure, or how abundantly clear does it become on what to measure? Because sometimes I feel like there's data for the sake of having data, but what data actually matters? What is the sleep well at night measurements that Katrina needs to have in order for her to feel like you're having profound impact on your community?
There are quite a few. And, at minimum, it's around access. So we definitely look at a variety of measures that could look like, even at minimum, how long does it take for our customer service to answer the phone? Are they answering it less than 30 seconds? Is it minutes? What does that look like for that member experience? And then what does it look like when they actually go to the provider's office? Did they find somebody that they thought matched their needs? Did they have to wait a really long time? And, were all of their needs met? There are surveys for those kinds of things, as well as, opportunities for members to give that direct feedback. We also have a lot of quality measures that are from our NCQA, which is the National Quality Healthcare Consortium of
Mhm.
measures. And those measures for us, it's about quality for outcomes. So we're looking at what happens when a member goes into the emergency room for mental health or substance use disorder issues and they're discharged. They didn't actually go into the stay. What happens after that? So measuring around that, and that looks like us getting the data from an actual visit or a lack of a visit, or our team trying to reach out to the member and seeing are we able to get connected to the member, phone number working, does the individual say that they have housing issues so that they can't actually focus on going to an appointment. They need housing, they
Right.
need food, they need transportation. So it looks like a lot of things. We look at those social determinants of health and see what we can assist with. And then are they going to the appointments that we would think that they would need to go to for those different diagnoses and those kinds of
So
things.
who reaches out to them? Is this sort of an advocacy team that's reaching out, or a team of nurses? Like talk to us a little bit about that.
So on the behavioral health side, we have a team of, we call them patient healthcare navigators. So
Hmm.
they help with that navigation of process and a little bit of the coordination of care. And then we also have social workers and licensed staff as well. So the licensed staff can be a licensed clinical social worker, a licensed marriage and family therapist within the behavioral health space so that they understand the social needs and the behavioral health needs. And they help identify what is the goal for that member. And then they help link the member where they need to get.
Interesting. So amongst the things that you're working on, where do you think the greatest opportunities for improvement lie?
Our youth,
Say that again.
our youth.
Talk to me about that.
So in our studies, we learn a lot about what shapes us. And there are many individuals that become very resilient, regardless of their upbringing. And it appears to be very innate. They become resilient. However, there are many
Right.
tools that can be supportive of, we'll just call them fragile families
Okay.
and spaces. So any opportunities that can offer to those families support so that they aren't feeling that stress, or they're feeling that support that they need to, you know, supply for their family, to, get those children to school, whatever that looks like. Because by adolescence, we're starting to see a lot of that behavior change. It comes along with the hormone change as well. So there's a lot of factors that happen around that time. And it's where we can see a split in a trajectory about where they end up exploring challenging behaviors or exploring other things. And so for me, I feel like as much as we can support the young ages so that they can have a better opportunity for a positive trajectory in life is where I think everybody should be focusing.
All right, so apply the same level of tactical prowess that you've been doing, and then how do you apply it to that particular youth group? Give me like if you had to do a little shift to make a dent and an improvement in that. Let's do like real-time problem solving here. Let's just as a little, just for fun.
For fun. So I am actually very excited because the state of California is now offering somewhat of that support that might have been a barrier for our adolescent and youth. And it is regardless of their insurance coverage, regardless of any residential status. The only qualification is that they need to be ages 0 to 26. And they can access the services for mental health services virtually. There's not zero, probably not much there, but you know what I mean? Like the families can also get the support to support their child, which, there has been such an increase in the adolescent anxiety, depression, and even in the past couple of years, there has been a significant increase in adolescent suicide, 20% in the state of California.
20%?
20% increase in California. So to know,
Whoa.
Yeah.
That's a heavy number. My goodness.
Yeah, it is extremely alarming. And I appreciate that the state has tried to acknowledge that in a way of making services available in an accessible way so that they don't have much barriers. And what I mean by barriers, I think of stigma, I think of finance, I think of, when I talk to my daughter about what her and her peers feel about mental health services, and she thinks that it's a privilege to access behavioral health services. And I'm, what are you talking about? We have access. Like, it should be known that it's okay to access services. And, she communicates that not everybody wants to leave their classroom and go to talk to the counselor. It feels like everybody knows something, or it just doesn't feel right for them. So knowing that they can have access with anonymity and within their own space, it can look like counseling, it can look like resource information, it can look like even peer support. And if that age group needs more services, like let's just say they are more intense and they are in crisis or suicidal, they can link them to the appropriate services. 988 came out to be last year or 2022, where that now becomes the National Suicide and Crisis Lifeline Prevention. So it's just nice to see that there are some shifts. We need to do more and normalize that it's okay to access mental health services, or it's even maybe just understanding what it is that's going on emotionally. There are a version of education that happens in the public school systems around what changes going on and what that looks like, but deeper dive, help them understand, put words to those feelings as they're getting older. So that's where I think a lot of attention can be had. And I'm starting to see a little bit of shift in the state of California. It'd be nice to see it nationwide.
It's brilliant. And maybe this is a great segue to talk about maybe some of the advocacy work that you're also doing in addition to that. So as we kind of round out this conversation, maybe you can share a little bit about that and some of your passions around that as well.
Definitely. So I started 2020 was an interesting year for everyone. And that was the year I decided I was going to start my nonprofit for parent and caregiver advocacy. I had personally been struggling with school supportive services prior to shutdown, let's just call it that.
Mhm.
And I knew that there were others that needed the support. And the nice thing about virtual was that I didn't have to be in the same space. So I have been assisting a lot of parents and caregivers by almost starting out just being a listening ear, hear what they're going through, and help them reflect on, that is very difficult. Using my therapeutic skills, that is very
Yeah.
difficult. And a parent just having that empathy and then helping them get the empowerment that they need so that they can do what they feel that they need, that their child needs, or their dependent needs, because it can be an adult dependent that needs that additional support. Understanding the complications of all of the systems of care. So we're not just talking healthcare, we're talking, even financial services,
Mm.
even um, social support, those kinds of things to be in your community, um, to understand what all that looks like, just helping them digest it. It takes a lot of time to digest it. At first, like for me, when I started to learn a little bit more about my daughter, she was maybe missing a couple of milestones, and I started to learn that there's something really significant. Like there's a part of
Mm.
grief that happened,
Yes.
and I felt like I couldn't focus on what needed to be done to support her because I was dealing with grief and just, recognizing that parents are going to have to allow themselves a little bit of grace that, yes, we are going to grieve. And it's not going to be the first time that you're going to feel that loss.
Mm.
It will happen again and again. And just, wrapping around that support. So I continue to offer a lot of that in a variety of ways. It can look like folks that are struggling in the schools of, hey, my kid's not getting what I thought that they should be getting, to even understanding, I'm a parent, I want to know more. Where do I
Right.
go more?
Yeah. Yeah.
So things like that.
So how can people follow your work? I know that it took even just a bit to get you come onto the show because you're so entrenched, you're so entrenched in your work. And I think oftentimes people they're so focused on getting stuff done that the idea of maybe coming on and sharing their story, they're like, well, I'm busy, I'm doing stuff, I'm doing my work. So I can only just say that number one, I appreciate it immensely. But then number two is, how can people follow what you're doing? Are there avenues in which you sort of share some of these wins, some of these learnings? And if so, maybe take just a few moments to share how they can kind of follow your journey personally and professionally as well.
Sure. So as professionally, I have definitely just recently started with Health Plan of San Joaquin, and we are starting to build up what's available to our communities. So we'll start to be leveraging a lot of the different platforms of sharing of information and making sure that others are informed of that. On a personal level, I do have you can edit this out. So if it makes good sense to share. But for my young daughter, because her diagnosis is kind of rare, she has what's called early infantile epileptic encephalopathy. It's a mouthful. It's a genetic condition that's not very much known. And I did not find any communities for that genetic condition. And so I started my own journey, if you will, through Facebook. And I post updates about her because in doing that, I have learned of other families that have now had children with the same or similar diagnosis.
Mm,
And they have the same story of, I didn't know there were any other parents who had a child with this diagnosis. I'm so grateful to find you. You know, what do you know? And so every time we explore something new, I post about it. I talk about her progression because honestly, our specialists have no clue what her progression or prognosis will be. And so that's just my little insight of just sharing that progress.
tremendous. And if there's one maybe action item that you would want someone who's listening to this, if they needed to take one action, what would that one action be?
I would say talk about mental health, talk about it, be a part of the conversation and help let people know it's okay. Just be there.
Well, Katrina, this has been just, you've over delivered. You've given us so many golden nuggets. It's amazing. And for those that have tuned in, if you've listened in and you found this conversation to be valuable for you, my one ask would be, would you mind sharing it? Would you mind just engaging with it on social media, liking it, commenting it, and maybe even potentially even reaching out to Katrina, just sort of support some of the things that she's in. So you're always welcome to come back onto the show, Katrina. It's great to see you again. And thanks for everything that you're doing.
Thank you so much. It was great being here.